Hey you guys, welcome back to Leah's Log, where I discuss my personal nursing journey. So I could not let this moment go by without talking about this pandemic, the coronavirus or COVID-19, and how it specifically has affected me being an orthopedic nurse. So let's get into it. The first thing I want to talk about is my entire day is specifically affected by coronavirus from the moment I wake up until the moment I come home. On the days that I work, and I only work 3 days a week, 12-hour shifts. Okay, so the first thing that affects me in regards to the coronavirus is that I have to take my temperature on the days that I work and record it into our temperature check database on our hospital's website. I specifically choose to take my temperature before I leave because the shift that I work is 7 a to 7:30 p.m. A whole bunch of people are trying to get into the door to clock in on time. So I will just be, extra late if I wait in this long line and try to get my temperature checked. Specifically, they're looking to make sure that you do not have a fever, which is one of the symptoms of the coronavirus. And if you have a fever, you're quarantined for 2 weeks and you have to stay home. So I check my temperature at home. I record it in a database. I take a screenshot of it. And once I take a screenshot of it, it should light up green, which means go, which means that I am able to basically work for that day. And if it was red, meaning if I had a temperature of 100.4 or above, I could not work for the day. So that's the first thing that happens. And if you do not take your temperature at home, again, I state you have to stay in this long line, then you have to go to their computer there and type it in, and someone has to monitor that it's actually in there. It's just a whole bunch of stuff. So at that same station, we're giving masks that we have to put on before we even leave out of that specific station, because we are going to encounter people from the moment we leave out of that station until we get to our unit. So they want to ensure that you have on masks, because we have to wear a surgical mask the entire shift that we are in the hospital. That is so new. I mean, breathing into things, it's I feel like I can taste the mess, but it's to keep us safe. But that is just a big inconvenience, and it's very hard, a big thing to get used to. But again, we're in the midst of a pandemic, so yes, it's keeping us safe and other people safe. So I am happy for that. So we have to wear that 24/7. Not only that, but we are to wear goggles. And so these goggles are specifically to be worn when we are in contact with patients. So once I go into my patient's room from the beginning of getting even as little as basically getting my bedside report, once we step foot into that patient's room, once we cross that mark into their room, we are to put on goggles and have them on the entire time that that we are in contact with the patient. So I don't have a specific pocket or anything that I can hold it in. So they kind of sit in the little my scrub pocket. A lot of times they fall off. They're falling on the ground. I have to clean them. So that's just one thing to get used to. But again, it's keeping us safe. So not only do I have a surgical mask, I have to wear goggles. I had to check my temperature. That's 3 things that have already been affected my day, or been added to my day now that we're in the midst of a pandemic. I wrote down some other things. So another thing that's going on is, because I am an orthopedic nurse, my floor is basically consists of people who are coming in for hip surgery, knee surgeries, shoulder surgery. So as you all know, all surgeries have been on a standstill. All elective surgeries have been stopped. Only patients that are coming in for surgeries is if it's vitally important, they need it now. That's the only time we're having orthopedic surgeries. So basically what's been going on is that all surgeries have been stopped, as I previously stated, and we're only taking surgeries that need to happen and can't wait until after the coronavirus. So prior to the coronavirus, I knew exactly who my patients were going to be when I came in. I am an orthopedic nurse, so I knew that I would have all orthopedic patients. I was not taking care of med-surg patients at all, because specifically I just started nursing in July. And so technically, if you are a new nurse under a year, you're not allowed to float. So I was good. I knew exactly who my patients were going to be. I was getting to the groove of how to care for them. And I had just come back from maternity leave in March because I had a baby. And I was just like, yes, I'm just going to have my orthopedic patients. I can hone in on my skills. And then coronavirus, the peak of it just came. And so our floor basically stopped having surgeries. And so our floor was vacant. And so what they decided to do was to make our floor responsible for caring for those who are immunocompromised, specifically those sickle cell patients or those, with cancer and things of that sort. So that was a new thing for me, getting used to using PCA pumps for sickle cell patients, just so many different things. So that was what our floor was originally supposed to be. But then again, another thing that's happening with the coronavirus is even though, a policy or instructions have been put out or guidelines have been put out, things change all the time. So in the midst of this, we just have to learn to be flexible. So we weren't just taking care of immunocompromised. Our floor turned into basically the place where all the ER admits, direct admits came to us. And so I was getting exposed to medical patients that I just had never got exposed to as a nurse. And so it was just very, 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 very scary for me. So that's another thing. So, I'm getting used to taking care of med-surg patients, which I never had taken care of as a new nurse. So it's pushing me out of my comfort zone. Another thing in how this coronavirus is affecting me is that due to our floor not having surgeries, our floor basically cannot staff the amount of nurses that basically are scheduled to work. So typically we have about 5 nurses that are scheduled to work every day, and we always have enough patients to cover that. Sometimes we need more because we have so many surgeries in a day. And so what's happening is that it's causing nurses to be called off, which is called VTO in our hospital, vacation time off. And initially when the coronavirus came to its peak, we had to use our vacation time. And so it just kept going. The census was low. And so basically they just implemented a policy where we were getting paid to basically stay home because we had no patients to take up. So periodically, maybe once like a month or once every 3 weeks, I am called off because the census is low and there's nowhere for me to even float. So in regards to floating, as I previously stated, there was a guideline at our hospital that if you have been a nurse for less than a year, you were not allowed to float. Well, it has changed. If you have been basically a nurse for more than 6 months, they are now requiring you to float, which means that a lot of times it's helping us not to stay home. We do have somewhere we can go. But as new nurses, and as for me specifically as a new nurse, it pushes you out your comfort zone because I felt lost. I can't talk for anyone else. I felt lost. I felt scared. I'm like, I'm just learning my specialty, and then you want me to go to another floor with new people that don't know I'm new, and you want me to act like I know everything. Sometimes nurses can just like scare you and stop you in your tracks. And I was just like praying, like, God, please let them call me off. I don't want to go in, because I knew that sometimes I knew when I would have to float because our floor was just like, it had no one in there. And so it's just been a lot of emotions up and down to try to basically get through this coronavirus. But I can say that it is pushing me to become a stronger nurse. I even had an opportunity where I actually had to basically train a nurse. She was like 20 years older than me or such, and she was like a clinic nurse. So because, a lot of outpatient procedures are canceled and things are not going on, they need help on the floors. They need people to come back and learn some of the floor nursing things, just in case we have a surge of patients that come in. They need all nurses on deck. And so I was like, wow, I'm not even a nurse for a year and I'm training someone. So coronavirus is just affecting all of us. What are other things I talked about? I talked about basically being exposed to new types of patients. One thing I want to talk about in regards to that I want to highlight specifically for new nurses or for anyone who's watching, when you're exposed to new patients, for me, I can just highlight some of the things that have helped me get through this. Is that initially I was scared. I'm not gonna lie to you, and I already said that. But one thing that I keep at the forefront, and I said this in my prior video of how my life after nursing school, is that I just remind myself that I went through nursing school, I graduated, I passed the NCLEX. So that means that I have everything. I know basically the basic knowledge to keep my patients safe, and I know how to follow doctor's orders. So the one thing I do when I go to a new floor, I collect my thoughts, I breathe, I go through the patient's file, I get everything that's pertinent as far as their allergies, as far as why they're here, who their doctor is, who's on board, as far as specialties, as far as like, if they're on board for psych, things of that sort, or if they're consulted for psych or podiatry, things of that sort, their allergies, their meds, their history. You get all the basic things, their labs or their hemoglobin's low. Maybe they'll tell you have to get blood. Just prepare yourself for the day. But majorly, I look at their orders and I let that guide my care. I just go to the basics and let it guide your care. And one thing I do ask is that when I get to the floor and it's a new floor, I ask those that are on the floor who actually work on that floor, permanently, I say, what are things I need to know as far as assessments? What are some lab vitals that I need to know? And I write that down. I have a little book that I carry. It's called my little nursing Bible, and I'll probably try to share that a little later, but I let that guide my care. And also, if you make a mistake, it's okay. It is okay. We learn from mistakes. There are mistakes that I've made in my first week of being on the floor, and I have never forgot them. I learned that when you make a mistake, more than likely you will never make it again. So breathe. You know the basics. Ask questions. Even if you get on someone's nerves and they're very short, ask. And if that person's very short, you go to the next person. Just make sure that you ask questions if you don't know something. So the coronavirus has greatly affected me. Last and foremost, I already stated that I have a baby. So when I come home, basically I don't even have any contact with my husband or my child because her immune system is, very immature right now. So I basically take off all of my scrubs. I immediately put them in a wash machine with some disinfectant and I wash them. I take a shower. I don't even wear my work shoes in my car. They stay in my lockers. I wear a different pair of shoes there. I try not to bring anything home that could affect any of my family here. I'm just trying to stay safe, and I wash myself. I wash my hands daily. I wash the knobs and have disinfectant spray. So yes, Corona has personally affected me, but we're making it through, and I feel honored and privileged to be a frontline nurse and to be able to provide care to those who are sick during this time. So yeah, so stay tuned. I hope you like this video and subscribe. All right.